Hi, today I'm going to talk about all the tests that we do to diagnose craniosynostosis. Now, craniosynostosis as a diagnosis is mainly clinical. We are able to make out generally what is the exact type of craniosynostosis by just looking at the baby and examining the baby's head, hands, feet and other organs. But we need some amount of diagnostic tests to confirm the diagnosis, and usually our favorite or the most gold standard test that is required is a CT scan of the head. The CT scan of the head actually gives us exact anatomical details of the bones, the sutures, the brain and everything else that is required for the diagnosis of craniosynostosis. Sometimes in syndromic craniosynostosis, we also get an MRI scan done to see the actual condition of the brain. Are there any anomalies in the brain and things like that. Other than CT scan and an MRI, we usually also get an eye checkup done to see if there is any optic disc swelling or something that is called as papilledema, which tells us that the brain is under pressure. So this is also an important test in the craniosynostosis protocol. Now these are the usual tests. In addition to it, we do many other tests as well, like for example, if there is a syndrome that is doubtful, we do a genetic testing done, which will give us the exact gene of which gene is involved and what is the name of the syndrome in syndromic craniosynostosis. Sometimes we can just get an X-ray done if we really don't want to go for a CT scan and if the diagnosis of craniosynostosis itself is doubtful. So these are some of the tests that we usually advise in the diagnosis of craniosynostosis.